Welcome everybody. I am Dr. Manar lecturer of medical parasitology. Today I would like to talk about Brachycera. This lecture will help you to know taxonomy, morphology, biology, life cycle, medical importance, prevention and control of the family Tabanidi of Brachycera. Now you will talk about family Tabanidi of Brachycera. Family Tabanidi which contain Tabanus species or horseflies, Chrysops, deer flies. Horse and deer flies are among the world's largest flies, and they are known to be extremely noisy during flight. Tabanids are very good vectors of the equine infections, anemia virus, as well as some trypanosoma species. Species in the genus Chrysops are biological vectors of Loa loa, transmitting this parasitic filarial worm among humans, and they have also been known to transmit anthrax in cattle and sheep and tularemia between rabbits and humans. Tabanids occur worldwide, being absent only at extreme northern and southern latitudes, and they are often encountered as bee-like insects that follow people outdoors and bombard them, acting as a nuisance factor, as they tend to favor the head and upper body, where they usually alight completely unnoticed by the victim until the painful bite gives them away. Let's talk about biology and the life cycle of Tabanidi. As with all other true flies, Tabanids go through complete metamorphosis, and the eggs are usually laid in large layered clusters of 25 up to 1000 on vegetation or other objects overlying water or moist soil. Incubation period is influenced by weather conditions, but during the warmer months, the usual range is from 5 to 7 days. Depending on the species, the larvae may be aquatic, semi-aquatic, or terrestrial. They hatch from the eggs and drop to the water or soil below, where they become predators of other invertebrates or small vertebrates. The head contains two sharp, slender mandibles. The larvae undergoes several molts as it grows and depend on species. The larval stage may last several months or as long as 2 to 3 years. Once the larva is fully developed, it moves into drier soil, usually 25 mm below the surface, to pupate. This picture showing different forms of larvae, aquatic, semi-aquatic, and terrestrial larvae. Depending on the species, the pupal stage lasts 5 to 21 days, and then the adult fly emerges from the soil. Mating occurs shortly after the adults emerge. Female horse and deer flies are blood-sucking insects where males fly feed on nectar and are of no consequence as animal or human beasts. Horseflies range in size from 19 to 32 mm long and usually have clear, solid colored wings and brightly colored eyes. Deer flies, which commonly bite humans, are smaller with dark bands across the wings and colored eyes similar to those of the horse flies. This picture showing adult Tabanid flies. A. Horse fly and B. Deer fly. And this picture showing morphology of head and antenna of Tabanid flies. On the left side horse fly and right side deer fly. Female horse flies and deer flies are active during the day. These flies are attracted to such things as movement, shiny surfaces, CO2, and worms. Once on a host, they use their knife-like mouthparts to slice the skin and feed on the blood pool that is created. It has been estimated that horseflies would consume 1 cubic centimeter of blood for their meal, and 20 to 30 flies feeding for 6 hours would consume 100 cubic centimeter. Bites can be very painful, and there may be an allergic reaction to the salivary secretions released by the insects as they feed. Horse and deer flies are intermittent feeders because their painful bite elicits a response from the victim, so the fly is forced to move to another host. This increases the likelihood to be involved in the mechanical transmission of disease following the blood meal. Oviposition comments. Let's talk about medical importance of Tabanidi. Medical importance of Tabanidi is two-sided. The annoyance and blood loss occur by the bite and infections transmitted chemically and biologically by the flies. Because of the large size of mouth parts, Tabanid bites are quite painful. Most people have little or no allergic reaction to them. Also, such sequelae can occur. Their annoyance factor may seriously interfere with use of areas and field workers and timber workers may have lowered productivity. A serious problem for livestock is blood loss, interrupted grazing, and energy consumed in trying to escape the insects. Caged animals suffered from these flies. Certain characteristics of Tabanids enhance their capability to transmit pathogen. Number 1. An autogamy, the necessity of a blood meal for development of eggs, stimulating host-seeking behavior. 2. Telmophagy, through which blood-dwelling pathogens can enter the bowls from which flies suck blood. 3. Relatively large blood meals, enhancing the possibility that pathogens will be imbibed. 4. Long engorgement time, enabling pathogen to infect a fly's tissue. And 5. Intermittent feeding behavior, increasing the chance for mechanical transmission of pathogens. Tabanids are involved in transmission of protozoan, helminthic, bacterial, and viral diseases of animals and humans. Among diseases caused by protozoa, two species of trypanosoma are transmitted mechanically by Tabanids. Trypanosoma evensi, the causative agent of sura in many wild and domestic animals, is spread by species of Tabanus. Other vectors such as stubble flies, other genera of horseflies, and bats also can be involved, but Tabanus species appear to be the most effective vectors of these trypanosomes. 2. The African eye worm, Lua lua, is transmitted by species of Chrysops. There appear to be two strains of Lua lua, one in monkeys in the forest canopy and one in humans. Night-feeding Chrysops transmit the former and diurnal one transmits the latter. 3. The arterial philaroid Eleuphora lives in head and neck vessels of American species of deer, elk, moose, and domestic sheep in the western states. It has no symptoms in deer, but in other hosts cause much distress, such as blindness, nervous dysfunction, necrosis, and head deformity. Species of Tabanus are vectors of these worms. 4. Bacterial infections known to be mechanically transmitted are tularemia, anaplasmosis. Tabanids are regarded as the primary vectors of anaplasma, a rickettsia that cause anaplasmosis in cattle, and anthrax. Tabanids are capable of mechanically transmitting the causal bacterium. And hog cholera and equine infections, anemia, viruses use horseflies as vectors. Let's talk about tularemia, sometimes called rabbit fever or deer fly fever. It's a zoonosis caused by the bacterium tularensis. Transmission is likely to be mechanical, with the bacterium being introduced into a bite wound via contaminated mouth parts. Feces of deer flies that are fed the bacterium experimentally have been shown to be infective when the feces is rubbed into abraded skin. Lesions develop with an ulcerated pinkish pit in the center and a raised ridge-like wheal around the perimeter. Bacterial septicemia and the result fever cause severe illness and even death if the person is not adequately treated with antibiotics. Talk about prevention and control. 1. Short-term control on livestock for several days may be achieved through the use of insecticides, but insecticide sprays often are not effective. Real application of pyrethroid insecticides can suppress local populations of certain tabanids over a period of several hours to perhaps a few days, but are considered far less effective than similar applications made for mosquito control. And use of insecticides for control of larvae or pupae, which are typically inaccessible in soil, is generally ineffective and can result in environmental damage. Insect repellents applied to human skin offer temporary relief for humans, but some individuals report poor results when using them. Number 2, avoid area or seasons with known high tabanid activity. Can help to reduce tabanid biting intensity. Because tabanid prefer to fly around rather than over vegetation or screen barriers over 2 meters high. Such a barrier can help to reduce tabanid access. 3. Another approach to tabanid control is water management. In areas where drainage or manipulation of water levels is feasible. Heavy rains during periods when tabanids are pupating can kill the pupa, result in fewer adults in a few weeks later. Number 4. In situations where oviposition sites are limited, removal of emergent vegetation on which tabanid eggs are deposited can result in a significant reduction in the number of eggs and larvae. Number 5. Traps are commonly used to monitor tabanid adults. They also provide another potential tool for control. 6. The use of chemical control agents also offers some potential for reducing tabanid populations. All stages of tabanids are subject to mortality by predators. Finally, these are references if you want to have a look. Hoping that lecture was useful for you all. Thanks and goodbye.